Have you ever wondered if one simple detail about your body, something you've known your entire life, could reveal the health challenge you're most likely to face after 60? Most people spend years worrying about cholesterol, blood pressure, or genetics. Those things matter. But there is another biological marker hiding in plain sight. It's printed on medical records, blood donation cards, and hospital forms. Most people never think about it after learning it: your blood type. Now, before you jump to conclusions, this is not about trendy blood type diets or internet myths. This is about what researchers have observed after following hundreds of thousands of people for decades. Study after study has found that blood type may influence how the body responds to inflammation, how blood vessels age, how the immune system behaves, and even which health conditions become more common later in life. Does that mean your blood type determines your future? Absolutely not. But it may provide valuable clues about where your body needs the most attention. Today, we're going to explore all 4 major blood types: O, A, B, and AB. For each one, you'll discover the hidden vulnerability that often appears after 60, the warning signs most people overlook, and the simple habits that may help protect your health for years to come. And stay with me until the end, because there's one important factor beyond your blood type that can dramatically change your personal risk profile, and most people have never considered it. Before we begin, tell me in the comments, what is your blood type? O, AB, or AB? Let's start with the most common blood type in the world: type O. If you're type O, you inherited what many scientists believe is the oldest blood type in human history. For thousands of years, survival depended on endurance, physical activity, and resilience. In many ways, your biology still reflects that ancient design. And there is some genuinely encouraging news. Research consistently shows that people with type O blood tend to have a lower risk of certain cardiovascular problems compared to other blood groups. One reason involves clotting factors. Type O individuals generally produce lower levels of specific clotting proteins. As a result, blood may flow more freely through arteries, reducing the likelihood of certain types of dangerous blockages. On paper, this looks like a major advantage, and in many cases it is. But here's where things become interesting. I've seen many older adults with type O blood assume that because their heart appears healthy, they don't need to worry as much about prevention. That assumption can become dangerous, because the greatest vulnerability for many type O individuals isn't always the heart, it's the digestive system. More specifically, the stomach. One of the most studied bacteria in the world is Helicobacter pylori, commonly called H. pylori. Millions of people carry it without knowing. The problem is that research has suggested this bacterium may attach more easily to the stomach lining of type O individuals. At first, there may be no symptoms at all, no pain, no warning, no obvious problem. But over many years, chronic irritation can slowly damage the protective lining of the stomach. Some people eventually develop gastritis, others develop ulcers. And in severe cases, long-term inflammation may increase the risk of serious complications later in life. That's why persistent indigestion, unexplained bloating, stomach discomfort, or recurring heartburn should never be ignored after 60. Many people assume these symptoms are simply part of aging. They're not. They're signals. And your body is asking for attention. If you're type O and you've never discussed H. pylori testing with your doctor, it may be worth asking whether it's appropriate for you. Early detection can make a significant difference. There is another challenge many type O individuals face: stress. Not because type O people experience more stress than everyone else, but because many of them respond to stress through action. They push harder, work longer, stay busy, keep moving. And while that determination can be a strength, it can also lead to chronic exhaustion. The body was designed to alternate between effort and recovery. When recovery disappears, health begins to suffer. That's why regular physical activity remains one of the most powerful tools for type O longevity. Not extreme exercise, not punishing workouts, simple consistency, daily walking, strength training a few times each week, maintaining muscle mass, protecting mobility. These habits help preserve metabolism, balance blood sugar, and support healthy aging far more effectively than most expensive supplements. So if you're type O, here's the takeaway. Your cardiovascular system may give you a valuable advantage, but your digestive system deserves careful attention. Protect your stomach, pay attention to symptoms, stay physically active, and never allow a perceived strength to become a reason for complacency. Because the healthiest people are rarely the ones who assume they're protected. They're the ones who continue taking care of themselves long before problems appear. Now let's talk about type A. And if this is your blood type, I want you to pay close attention because this is where many people are surprised. On the surface, type A individuals often appear to be doing everything right. They're responsible. They follow medical advice. They schedule checkups. They try to eat healthier. And yet, many still find themselves dealing with blood pressure issues, cardiovascular concerns, and chronic stress as they move through their 60s and 70s. Why? Part of the answer may be hidden in the way their bodies respond to stress. Researchers have observed that type A individuals often show physiological patterns associated with stronger stress responses. Now, stress itself isn't the enemy. Without stress, we wouldn't react to danger, solve problems, or stay motivated. The problem begins when stress never switches off. Think about it. How many people wake up worried, spend the entire day rushing from one task to another, and then carry those same worries into bed at night? For the body, that constant state of alertness creates wear and tear over time, and after 60, those effects become harder to ignore. One area particularly affected is the cardiovascular system. Several large population studies have suggested that people with type A blood may have a slightly higher risk of certain heart-related conditions compared to type O individuals. The difference isn't enormous, but over decades, even small differences matter, especially when they're combined with high blood pressure, poor sleep, excess weight, or chronic stress. This is why many health professionals now view stress management as a legitimate part of preventive health care, rather than a luxury. Unfortunately, many older adults still treat relaxation as something they'll get around to later. Later rarely comes. The body keeps the score, and eventually it starts sending signals. You may notice increased blood pressure, more fatigue, poor sleep quality, a racing mind that refuses to slow down, frequent headaches, muscle tension, or a feeling that you're constantly running on empty. These symptoms are often dismissed as normal aging, but they're frequently signs that the body's stress response system has been working overtime for years. There's another marker worth discussing: homocysteine. Most people have never heard of it, yet it can provide valuable information about cardiovascular health. Homocysteine is a naturally occurring amino acid in the bloodstream. When levels become elevated, it may contribute to damage within blood vessels. Some studies suggest that type A individuals may benefit from monitoring this marker, particularly if there are additional cardiovascular risk factors present. The encouraging part is that lifestyle choices can strongly influence it. Foods rich in folate, vitamin B6, and vitamin B12 help support healthy homocysteine metabolism. Dark leafy greens, beans, eggs, fish, lean meats. Simple foods that most people can incorporate into their routines without difficulty. But perhaps the most powerful intervention for type A individuals isn't found in a pill bottle or a laboratory. It's found in daily habits, specifically creating moments when the nervous system can truly relax. The key word is daily, not once a month, not after a vacation, not when life becomes less busy, every day. Because the nervous system responds to repetition. Even 5 or 10 minutes of controlled breathing can influence how the body handles stress. One simple approach is slow, diaphragmatic breathing. Inhale gently through the nose. Allow the abdomen to expand, then exhale slowly and completely. Repeated consistently, this practice may help reduce the physiological burden of chronic stress. And here's something many people don't realize. Your heart doesn't care whether stress comes from work, finances, family conflict, or watching upsetting news all day. The body responds similarly. Stress is stress. That's why managing your information diet can be just as important as managing your food diet. If every day begins with anxiety and ends with worry, the body never receives permission to recover. Type A individuals often spend years taking care of everyone else: children, grandchildren, spouses, friends. But longevity requires learning to care for yourself with the same dedication. Because prevention isn't selfish, it's necessary. So if you're type A, here's your takeaway. Your greatest challenge may not come from a single disease. It may come from the cumulative effects of stress acting on your cardiovascular system year after year. Protect your heart by protecting your nervous system. Monitor your blood pressure. Prioritize sleep. Eat foods that support vascular health. And build a daily stress reduction habit that becomes as automatic as brushing your teeth. Small actions repeated consistently create powerful results. And for type A individuals, those results can make a remarkable difference over time. Now let's move on to type B, because this blood type may be the most misunderstood of them all. Type B. If you have type B blood, there's a good chance you've spent much of your life feeling like your body responds differently than other people's. Maybe certain foods seem to affect you more. Maybe your energy levels rise and fall unpredictably. Or perhaps you've noticed that while some people can get away with unhealthy habits for years, your body quickly lets you know when something isn't right. Interestingly, researchers have long considered type B one of the most biologically adaptable blood groups. Historically, this blood type became more common among populations that migrated across vast regions, encountering new climates, new foods, and new environmental challenges. Adaptability was survival, and in many ways that flexibility remains one of type B's greatest strengths today. Many type B individuals tolerate a wider variety of foods than other blood types. Their bodies often handle dietary changes more efficiently. Their metabolism can be remarkably resilient, but every strength has a shadow side. And for type B, the concern isn't necessarily what happens when everything is going well. It's what happens when chronic inflammation quietly begins to build. Inflammation is a word we hear constantly today, but most people misunderstand what it means. Acute inflammation is helpful. It's the body's emergency response system. You cut your finger. You fight an infection. Your immune system activates. Problem solved. The danger comes from chronic low-grade inflammation, the kind that stays active month after month, year after year, the kind you can't feel until damage has already accumulated. Many researchers believe that chronic inflammation sits at the center of numerous age-related diseases: heart disease, type 2, diabetes, joint degeneration, certain autoimmune conditions, cognitive decline. And for many type B individuals, keeping inflammation under control may be one of the most important longevity strategies available. Here's where modern life creates a problem. Our ancestors didn't spend their days surrounded by ultra-processed foods, sugary drinks, artificial additives, and highly refined oils. Our bodies evolved for a completely different environment. Yet today, many people consume inflammatory foods several times a day without realizing it. Breakfast, snack, lunch, dessert, another snack. The immune system never gets a break. For type B individuals, maintaining a low inflammatory baseline may be especially important. This doesn't mean perfection. It doesn't mean eliminating every enjoyable food, but it does mean paying attention to how your body feels after meals, paying attention to persistent fatigue, paying attention to unexplained aches and pains. Because sometimes what people call getting older is actually chronic inflammation speaking. One of the challenges with inflammation is that it rarely arrives dramatically. It arrives quietly. You wake up a little stiffer. You feel slightly more tired. Recovery takes longer. Energy becomes less predictable. Many people adapt to these changes so gradually that they stop noticing them, until one day they realize they no longer feel like themselves. This is why routine health monitoring becomes increasingly valuable after 60. One marker often discussed by physicians is C-reactive protein, commonly called CRP. CRP is a blood test that can provide clues about inflammation levels within the body. While no single test tells the entire story, elevated CRP may serve as an early warning sign that something requires attention. And early warnings are opportunities, because once inflammation becomes deeply entrenched, reversing its effects becomes much harder. Fortunately, some of the most effective anti-inflammatory tools cost very little. Walking, consistent sleep, maintaining a healthy weight, eating more vegetables, reducing ultra-processed foods, managing stress. These aren't glamorous solutions, but they work. In fact, many people spend years searching for the perfect supplement while ignoring the habits that have the strongest scientific support. Movement deserves special attention here. Interestingly, many type B individuals seem to thrive with steady, moderate exercise rather than extreme training programs. Walking, swimming, cycling, hiking, activities that elevate the heart rate without overwhelming the body's recovery systems. The goal isn't punishment. The goal is consistency. A body that moves regularly ages differently than a body that remains sedentary. The difference becomes increasingly obvious with every passing decade. There's another reason type B individuals should pay attention to inflammation: autoimmune conditions. Now, having type B blood does not mean you will develop an autoimmune disease. Far from it. But immune regulation appears to be particularly important for this group. If you've been experiencing persistent fatigue, unexplained joint pain, recurring digestive issues, unusual skin changes, or symptoms that seem difficult to explain, don't automatically assume it's simply aging. Those symptoms deserve investigation. The earlier potential problems are identified, the more options usually exist. And that's what preventive health is all about: finding issues while they're still manageable, before they become life-changing. So if you're type B, here's your takeaway. Your body possesses remarkable adaptability. That's one of your greatest gifts. But adaptability doesn't mean invincibility. Protect yourself from chronic inflammation. Prioritize movement. Eat foods that support rather than challenge your immune system. Pay attention to persistent symptoms. And remember that small warning signs often appear years before major health problems. The people who age best aren't always the ones with perfect genetics. They're the ones who listen when their bodies whisper instead of waiting until they scream. Now let's move to the rarest and perhaps most fascinating blood type of all, type AB. If you have type AB blood, you belong to the smallest blood type group in the world. Only a small percentage of people carry it. And because it combines characteristics of both type A and type B, researchers have long considered it one of the most unique blood profiles in human biology. In many ways, type AB individuals benefit from the strengths of both parent blood types, but they may also inherit some of the challenges. And after 60, one particular area deserves special attention: the brain. When most people think about aging, they worry about heart disease, cancer, diabetes. But ask older adults what they fear most, and many will give a different answer. They fear losing their memory, losing their independence, losing the ability to recognize loved ones, losing the experiences that make them who they are. This is why cognitive health has become one of the most important topics in modern longevity research. And several studies have suggested that individuals with type AB blood may face a somewhat higher risk of cognitive decline later in life compared to some other blood groups. That does not mean memory problems are inevitable, not even close, but it does mean prevention matters. The connection appears to involve circulation. Your brain depends on a constant supply of oxygen and nutrients. Every thought, every memory, every conversation, every movement, all of it relies on healthy blood flow. When circulation becomes compromised over many years, even slightly, the effects may gradually accumulate. Not overnight, not dramatically, but slowly. And that's what makes cognitive decline so deceptive. It often begins decades before symptoms become obvious. Many people assume memory loss simply happens with age, But aging alone doesn't tell the whole story. The health of your blood vessels plays an enormous role. Blood pressure, blood sugar, cholesterol, inflammation, physical activity, sleep. All of these factors influence how well the brain functions over time, which means protecting your brain starts long before memory problems appear. One nutrient that receives considerable attention in brain health research is omega-3 fatty acids, particularly DHA. DHA is a major structural component of brain cells. It helps maintain healthy cell membranes and supports communication between neurons. Fatty fish, such as salmon, sardines, trout, and mackerel, are excellent sources. For people who don't regularly eat fish, discussing supplementation with a healthcare professional may be worthwhile. But nutrition is only part of the equation. Sleep may be even more important. And unfortunately, it's often overlooked. During deep sleep, the brain performs critical maintenance. Think of it as a nightly cleaning crew. Waste products accumulate throughout the day. During sleep, specialized systems help remove them. When sleep becomes chronically restricted, that cleanup process becomes less efficient, night after night, month after month, year after year. The effects accumulate. Many adults proudly announce that they only sleep 5 or 6 hours per night, as if needing less sleep were a sign of strength. In reality, most people require significantly more, especially as they age. For type A/B individuals, consistent, high-quality sleep may be one of the most powerful investments they can make in their future cognitive health. But there's one more factor that deserves attention: mental activity. The brain thrives on challenge, not passive entertainment. Challenge, learning a new skill, practicing a language, playing a musical instrument, solving complex problems, reading material that forces you to think deeply. These activities help create new neural connections and strengthen existing ones. In other words, the brain behaves much like muscle tissue. Use it and it adapts. Ignore it and it weakens. So if you're type A/B, here's your takeaway. Your brain deserves the same attention that most people give their heart. Protect your circulation. Prioritize sleep. Stay physically active. Feed your brain with meaningful challenges. And begin those habits today, not someday. Because cognitive health is built over decades, not weeks. Now, before we finish, there's one more piece of the puzzle that almost nobody talks about, and it could apply to every blood type we've discussed today: the Rh factor. Most people know their blood type as A, B, AB, or O, but there is another designation attached to it: positive or negative. For example, O positive, A negative, B positive, AB negative. That plus or minus sign represents something called the Rh factor. And while researchers are still exploring all of its implications, evidence suggests that Rh positive and Rh negative individuals may not respond identically to certain immune and inflammatory processes. In simple terms, two people with the same blood type may still have slightly different biological tendencies depending on their Rh status. This doesn't mean one is better than the other. It simply means that understanding your complete blood type gives you a more complete picture of your biology. And that's really the central message of everything we've discussed today. Because there is something incredibly important that many people misunderstand. Your blood type is not your destiny. It never has been. Statistics are not predictions. They're probabilities. And probabilities can be influenced. Every single day, I've met people with multiple risk factors who remain vibrant and healthy well into their 80s. And I've met people with seemingly perfect health profiles who ignored warning signs until serious disease developed. The difference often comes down to awareness. Awareness creates action. Action creates habits. And habits create outcomes. That's why the purpose of understanding your blood type isn't fear, it's preparation. If you know where your body may be more vulnerable, you can strengthen those areas before problems appear. That's the entire goal of preventive health, not waiting for disease. Preventing disease. So whether you're type O, AB, or AB, remember this. Your biology may load the gun, but your daily choices pull, or don't pull, the trigger. The food you eat, the sleep you get, the exercise you perform, the stress you manage, the relationships you maintain, the habits you repeat every day. These factors influence your future far more than most people realize. Your blood type may offer clues, but your lifestyle writes the story. And the good news is that the story is still being written. Thank you for spending this time with me today. Now I'd love to hear from you. What is your blood type? And did any part of today's discussion sound familiar based on your own experience? Share it in the comments below. I read them carefully, and many future topics come directly from the questions and experiences this community shares. And if you found this information valuable, make sure to watch the next video where we'll discuss some of the most commonly overlooked warning signs that appear years before serious cardiovascular disease develops. Until then, take care of yourself, because the more you understand your body, the better equipped you are to protect it for years to come.